is August 24th, 2021. I've already washed my hands. Hi, my name is Natasha. I'm a nurse practitioner student at the University of Memphis. I'm going to be doing your assessment today.
Okay.
As I go through and assess her skin, I'm going to be looking for color, moisture, texture, temperature, edema, turgor, lesions, scars, bruising, and nevia. As I look at her head's symmetrical to her body. It's in midline. As I look at her hair, I'm looking for color and distribution, texture. As I palpate, I'm palpating for any kind of tenderness. Does this hurt at all?
No.
Any depressions, lesions, masses, and also looking for any kind of infestations. I'm going to palpate her temporal arteries for any tenderness. Does this hurt?
No.
Okay. I'm going to assess my lymph nodes. This is the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, the submental, the anterior cervical, the posterior cervical, and the supraclavicular. I'm going to have you bite down and go left to right. I'm checking for PMJ, subluxation, tenderness, crepitus. Does that hurt at all?
No.
Can you bite down? I'm checking the messenger muscle. Can you feel this?
Yes.
Can you feel this?
Yes.
Can you feel this?
Yes.
Can you feel this? Can you
Yes.
feel this? That's checking cranial nerve 5. I'm going to go ahead and do my light sensations on the extremities. Can you feel this?
Yes.
Can you feel this?
Yes.
Can you feel this?
Yes.
Can you feel this? Can you feel this?
Yes.
Can you feel this? Can you feel this?
Yes.
Can you feel this? Okay. I'm going to ask you to raise your eyebrows, smile, frown, purse your lips, blow your cheeks out. Okay, that's checking cranial nerve 7. As I look at her ears, they're symmetric to her body. They're appropriate size. I'm going to palpate the tragus and pinnae for any tenderness or masses. Does this hurt at all?
No.
I'm going to look inside her ear at the tympanic membrane and the inner ear. Bilateral. No redness, edema, or drainage noted. I'm going to be checking cranial nerve 8 with the Weber's, Whisper, and Ryan's test. I'm going to put this in the middle of the head. Let me know if you can hear the vibration bilateral or just one side.
No.
Okay? And let me know when you lose the vibration.
No. No.
Okay? And again on this side.
No. No.
Okay? And I'm going to tell you a number and I'm going to whisper something and you tell me what it is.
9. 9.
Okay, and I'm going to go ahead and check for the vibratory over the malleus medius and the ulnar.
No.
Okay.
No.
Okay.
No. No.
Okay. As I look at her, I'm going to look at her eyelashes, her eyebrows, and her palpable fissure. I'm going to assess her sclera and conjunctiva for any discharge, color, drainage. I'm going to have you look at this and tell me what's the lowest line that you can read.
DEFPOTEC.
Okay, cover your left eye.
DEFPOCE.
Okay. And cover your right eye.
DEFPOTEC.
Okay. She has 20/20 vision with corrective lenses, and that's checking cranial nerve 2. I'm going to check your pupils, so if you'll just remove your glasses. Okay. And just follow my hand. And then I'm going to ask you to tell me when you can see my finger.
No. 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 No.
Okay, and that's checking cranial nerve 3. I'm going to now ask you to follow my hand with just your eyes. And that's just checking for any kind of extraocular eye movement, and that's checking cranial nerves 3, 4, and 6. Now I'm going to check her nose is in her midline. I'm going to check her nares for patency. And both nares are patent. I'm going to ask her to smell this and tell me what it smells like.
Apple.
Okay, and that's checking cranial nerve 1. I'm going to palpate her axillary and or maxillary and frontal sinuses. Does that hurt at all?
No.
Okay. I'm going to assess the inside of her mouth. If you'll just open up and say ah. Okay. I'm looking the inside of her mouth at her mucosal, her buccal, her soft palate, her tongue, her salivatory ducts, and her pharynx, and her tonsils, her teeth, her gums. Can you stick your tongue out and say ah? Okay. Her soft palate and uvula rises and falls with phonetation, which is cranial nerve 9 and 10. Can you stick your tongue out? Okay. And her tongue is in midline without fasciculations, and that is cranial nerve 12. Can I get you to shrug your shoulders against resistance? That's checking cranial nerve 11. I'm going to palpate her trachea for midline, which it is. I'm going to then palpate her for a thyroid. Can you swallow for me? Okay. I'm going to check her carotid pulses. And I'm going to listen for her carotid, for carotids for bruise. Okay. And I am going to go ahead and have her turn around so we can do her posterior chest. And as I look at her chest, I don't see any asymmetry. There's no signs of any kind of like sternal retraction or labored breathing, nasal flaring, anything like that. I'm going to check for tactile firmness. Can you say 99?
99, 99, 99, 99, 99.
Okay. I'm going to percuss in between the intercostal spaces. Okay. And I'm going to auscultate her lung sounds. Take a deep breath in and out. Okay, I'm going to check for the whisper, bronchophony, and echophony. So if you would you please say 99?
99,
Again?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, can you say E?
E, 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 E.
Okay, can you whisper E? Okay, and I'm going to check for any kind of CVA tenderness. Just let me know if it hurts.
No.
Okay, let me turn back around. As I'm looking at the anterior chest, I don't see any kind of labor breathing, no sternal retraction. I don't palpate any asymmetry, everything's symmetrical. I'm going to palpate for tactile firmness. Can you say 99?
99, 99, 99, 99.
Okay, and I'm going to auscultate her lung sounds again on the front. So just take deep breaths in and out. Okay. Now I'm going to listen to her 5 points heart sounds. So this is her aortic, pulmonic, herbs, tricuspid, and her mitral. And now I'm going to palpate for a PMI. And I'm going to listen to her apical pulse for 1 minute. her rate is 62, and her rhythm is normal with no gallops noted. Okay, as she goes to lay down, I'm going to look for my JVD at 30 to 40 degrees, which is absent. I see no lifts or heaves. I'm going to palpate over the 5 heart, so aortic and pulmonic, herbs, tricuspid and mitral. I'm going to then auscultate again. I'm sorry, aortic, pulmonic, herbs, tricuspid, and mitral. I'm going to go ahead and auscultate the aorta for bruits, the renal arteries, the iliac arteries, and the femoral arteries. And I'm going to listen to her bowel sounds in all 4 quadrants. I don't see any contours or any asymmetry in her abdomen. I'm going to now percuss for tympany flatness and dullness. I'm going to palpate for any tenderness or masses. Does that hurt?
No.
Okay. I'm going to ask you to take a deep breath in. I'm going to look on the left for the spleen and the right for the liver. Okay? You can breathe now. I'm going to sit you up. I'm going to check my deep tendon reflexes. So this is brachial radial. This is the bicep. And tricep. Brachial radial, bicep, tricep, the patellar, and the Achilles, and the Barbenskis. Alright, I'm going to check my grathesia and photography. So if you'll just tell me what this is in your hand.
A key.
Okay, and can you tell me what this is?
Coin.
Okay, and I'm going to write a number in the palm of your hand. Can you tell me what it is?
9.
Okay, now I'm gonna, you can open your eyes. We're gonna check your cerebellar reflex or coordination, I'm sorry. So can you take your hand and go back and forth like this, flip flop your hands? Can you do your fingers like this? And can you do finger to mine? Okay. As I go through her hands and feet, and her wrists, her upper and lower extremities, I'm going to be looking for any abnormalities such as masses, nodules, lesions, scarring, bruising, swelling, edema, redness, any kind of skin discoloration. I check her finger capillary refill. It's less than 30 seconds. Check her radial pulses, which are present. I'm going to check her fingers for flexion, extension, hyperextension, abduction, and adduction, and then thumb opposition. And then I'm going to check her wrist for ulnar deviation, radial deviation, extension, hyperextension, and flexion, and rotation. I'm going to check her elbows for flexion, extension, and hyperextension. Okay, can you squeeze my hands for me? Okay, can you push against me with your arms? Can you pull against me with your arms? Okay, and I'm going to check her shoulders for flexion, extension, hyperextension, abduction, adduction, circumduction, internal rotation, external rotation. Okay, and then I'm going to do her toes for capillary refills, which are less than 3 seconds. I'm going to do dorsalis medial pulses and posterior tibial, which are both present. I'm going to look at her feet and get her to do flexion, extension, hyperextension, abduction, and abduction. I'm going to get her to do her wrists, her ankles, inversion, eversion, flexion, extension, hyperextension, and rotation. I'm going to get her to do her kneecaps, in flexion, extension, hyperextension. I'm gonna get you to push against my feet, or my hands with your feet, okay? And then can you pull back, okay? And I'm gonna get you to pull with your feet, okay, and push against my hands, okay? And I'm gonna get you to stand up for me, okay? And with your hips, I'm going to get you to flexion, extension, hyperextension, adduct, internal rotation, external rotation, and circumflexion. Okay, and I'm gonna get you to turn around, and when you push your leg out for me, like out this way, okay? And can you try to pull it in for me, okay? And turn around. We're gonna check your spine. And when we check her spine, I'm looking for any kind of abnormality for kyphosis, scoliosis, things like that, and it looks normal. When we do your lumbar spine, we're going to get you to do flexion, hyperflexion, or flexion, extension, hyperextension, and lateral flexion, and then rotation. Same with cervical spine. You're going to do flexion, extension, hyperextension, lateral flexion, and then rotation. Okay? When we turn back around, I'm going to get you to put your hands to your side and close your eyes. We're checking the Romberg, which is normal. I don't see her swaying at all. I'm going to get you to walk back and forth for me. Okay, and her gait is regular and tandem. And can you hop on one foot for me? Can you hop on the other foot for me? Okay, thank you.